we are overweight, is actually the fat accumulation. And that lead to many medical issues. You can end up with a metabolic syndrome, your increased risk of developing diabetes and cardiovascular problem, which means that you can get stroke, you can get a heart attack and a renal problem, kidney problem. So all these are often related to being overweight. And even cancer, the incidence of cancer is control. Diet alone will help you to reduce weight. It's the single most important factor, diet. Okay. So if I am overweight, you are not overweight, okay? But I exercise every day. I walk 1 hour, just walking 1 hour, and you don't. I will outlive you.
Okay, welcome to Break It Down, everybody. In this podcast series, we actually sit down with professionals from different fields to learn and explore various topics, and also hear their unique perspectives. So for today's episode, we are very honored to be joined by Dr. Elias, Medical Director of EHA Clinic. So welcome, Dr. Elias.
Thanks, Bernard, for inviting me today. Be happy to have some chit-chat and have some fun.
Thank you for joining us today also. So Dr. Elias, I think you have a long credentials also. So just let me go through this together with the audience so they know.
I'm not sure if it's accurate, but well, let's go.
Should be accurate. This is from the website also.
Okay.
So Dr. Elias, you have been practicing aesthetic medicine since 1993.
Oh, that is, I graduated in 93. I started my clinic in 1998.
1998. So it has been about 20 plus years.
27.
27 years so far. Oh, that's a long period of time. Okay. And at the same time, you're also the clinical lecturer of University College of London.
Yes.
And also, you also have a Master of Surgery in Aesthetic Medicine.
My master is Master of Science in Aesthetic. And the course I'm teaching at University College of London, UCL, is Master of Surgery in Aesthetic.
Right. You're also the master trainer for numerous pharmaceutical companies.
We try to teach the next generation of doctors to become trainers so that the skill doesn't disappear with us.
Right.
It will continue to get better with time.
And you have been doing this for how long already?
My first lecture for doctors was in 2007.
Right.
And I started the cadaveric workshop for doctors. I call it My Face Cadaveric Workshop in 2010. Yeah.
So, in a sense, now it's 2025, 15 years down the road. I guess you have a lot of students.
Oh yeah, we have a lot of people have gone through the course. And cadaver is especially important if you are going to be injecting or doing treatment on the face, right? And it's like any other surgical discipline where cadaveric treatment or cadaveric learning dissection is an important component of the whole learning process.
Right. So actually nowadays, I think a lot of doctors also, they can call you 师傅.
In a way, sometimes they do that.
Nice.
It's everybody learn from each other. And I always tell them that today I teach you because I have walked the journey before you. But that doesn't mean anything actually, because many of them will go on to learn new things, which I may not be able to pick up so quickly. There are always new things. And many times they're the ones that come back to me and share with new knowledges that they have picked up with me. And I am learning from them after a number of years.
And also in your clinic practice so far, you actually conduct quite a variety of aesthetic treatments, from weight management to hair loss treatments, face and body contouring treatments, all also. But today in particular, we would like to dive deep deeper into the medical approach in losing weight.
Okay.
So today we're going to talk more about losing weight. Before we begin, we also like to know a bit more about our medical journey, how you get started into being a doctor in the first place.
I think in people born in the 60s, there are only very few professions that parents we can aspire to. Is doctor, lawyer, architect, engineer, right? So it's also in a way after A level, looking at the thing, what shall we do? Army, don't get angry, but when we were in BMT, right? If you going for interview, you get half a day off to go for interview. So I applied for everything, for Navy, the Army, medical school, everything, right? Because then you get half a day off here and there, scholarship, everything. So you get a bit more off and get an escape from Tekong for half a day.
This is very important.
And so happened that the medical school, or the medical application got through, and I got into medical school first. Of course, subsequently, there are a few other things that came along, but once I've accepted medical school, I could not take on any other. So otherwise, I could be an army general now. I don't know.
Maybe you're running for the next election also.
From there.
Right. And actually, how did you start to begin practicing aesthetic medicine?
It was actually just that I started a clinic, and initially I pursued more into family medicine. It's broad-based and I enjoy variety. Probably because I'm ADHD, I think, I don't know, my children, I have 2 boys who are ADHD. So I think it must be from me, right? They say that it's from man, from the father. And I like variety.
Yep.
And so in the beginning, it's a very broad base. I pursue further the diploma in family medicine. But I realized that a lot of the patients, the challenges they have is related to skin. So I pursue further and took a diploma in dermatology, postgraduate diploma in dermatology. But yet it's still not enough. Like I mentioned about tattoos, about some of these issues that they have. So I went on to learn about all this treatment from various specialists. Some of them dermatologists, plastic surgeon, and there was a course then, American Academy of Aesthetic Medicine. So I took that course as well. There are different stages of it. I completed it, and one of the examiner, I think he's the founder, Michel Deloun, and he told me, "Hey, you seem to know your stuff." It happened that I was doing my dermatology at the same time, right? So very familiar and could answer the final exam, the Viva, very well, or reasonably well, and he said, "Hey, come join us as a lecturer." Became one of the first faculty members for the A3M in Singapore, and that's when I realized that, hey, wow, actually it's quite fun, and the reward is quite immediate. Like people playing computer game, they want immediate reward. Aesthetic, in a way, also has that little bit of effects where when you do a treatment, patient get nice result rapidly, and that fuel your interest more. So it's like a feedback loop, a positive feedback loop. It's like a drug. You get addicted to it. So you do more and more of that. And of course, over time, people start to call it aesthetic medicine and all that. So so these people call us aesthetic doctor. But actually, we are just a doctor with a special interest in it. It's more because of the patient needs that we are pursuing, trying to help them in some way.
Right. Yeah. I think, something that I'm more interested to find out also, since you have been practicing medicine, aesthetic medicine for so long, do you see any trends, like what do the patients come to you from last time? And then is there a change and compared to today also?
I think it's not a change. It's more of Singapore is an aging population. And with that, there are bigger proportion of patients who have issue related to aging. So we have more pigmentation related to aging, more melasma, and also saggy skin. So that seems to have more. And at the same time, we also notice there are more men who will come forward for treatment. Hair loss is a common thing, right? Because a lot of people start hair loss that is genetic. But at the same time, we also notice that because our working life have extended tremendously from the old days where people will retire at 55. Today, even at 65, you are still working, right? I mean, officially 65, but there's so many people 70, 75, and they're still working.
And still very active.
Very active, very healthy. And because of that, more of them need to compete with the younger people. And so they say, can you make me look less tired, make me look less aged? I want to look how I feel, because people are healthier, they live longer, they feel healthy, they feel young, but yet the face or the appearance and how they feel, there's a mismatch. And so we're trying to help them to look and feel better
from there. Right. Nice. Now let's talk about weight loss.
Oh, weight loss, okay.
Let's start from the very beginning. So why is weight such a huge concern to health, and why should we care about it?
Well, why do people become overweight? Actually, it's genetic. From the evolution of human, how did we survive today? Due to natural selection, where food was in short supply in ancient time, those who survive are those who are able to store as much energy as possible. So the gene selection are those who could store and look for food and store up the excess energy. And because of that, we all inherited the same genes, which is where we tend to crave and look for high calorie food, and we are able to store them for rainy days.
For survival.
But with time, economy has changed. Food is in abundance. But we cannot stop eating. It's a genetic thing. We crave for it. So we tend to overeat more than we need, and we store up because in our deep and the subconscious level, genetic level, we always fear that the next meal may not come so soon, and so we tend to overeat, and as a result, we tend to be overweight. I think worldwide, overweight itself is over 43%.
Wow.
And that's worldwide, despite the large number of famine and all that, right?
Correct.
If you look at certain country, overweight and obese are different, right? So overweight is just slightly, but obesity is much more high with the BMI over 30.
Yes.
And some country, the obesity can reach over 40%. I think the highest is Samoa, and they're like 75%.
Wow.
Obese, okay?
Wow.
75% obesity. America is like 40%. Singapore is much lower, about 10 to 14%. So it's actually not bad. But overweight, I think Singapore also over 40% overweight.
Yes,
so that's a tendency.
Right.
Yeah.
Why should we be concerned about being overweight?
I think overweight itself is often linked to medical issue, especially if you're overweight because of fat accumulation and not muscles. There are two types. Some are actually very muscular. They're actually muscles. That is not a problem. Because then it's good. But very few of us are actually bodybuilders and full of muscles. Majority of us, for those who are overweight.
Yes.
Yeah.
Wow, okay. I think when you talk about the fat percentage and the muscle percentage, I think there's also a school of thought nowadays that the fat percentage is actually more important than your BMI.
Exactly. That's what I'm talking about just now, that if I'm overweight because of muscles, it's not an issue. And there are a lot of people who are now doing all this muscle building. So when they're overweight, it's not a concern.
True.
But if it's actually a result of too much fat, percentage of fats being higher, then that's not good. As a policy, I mean, BMI is still a good gauge for a population wide, because for policymaker, I don't think it's going to be easy for them to try and get everybody to go and measure fat content and all
it's
that.
a bit hard to measure also.
Yeah, so BMI is easy from a policy perspective, and it does match the general health based on just BMI alone. But at the individual level, we do not just look at BMI ourselves, unless we know that, okay, my abdomen has central obesity, I can feel all the fat, then obviously BMI is a reasonable gauge. But otherwise, fat content, especially central obesity, if I'm generalized, or well distributed, the incidence of all these medical issues is not as bad. But if I have central obesity, that means the fat are all mainly inside the abdomen, inside there, right? Then the incidence is definitely higher, because that is a very clear sign that you are likely to develop metabolic syndrome, and the risk of all this cardiovascular problem is definitely higher.
Yeah, but that's something that we see quite commonly nowadays.
Yeah,
we call it dead bod, right?
A dead bod. Yeah.
But that is also quite common nowadays for people in 30s, 40s.
In a way, yes.
It seems like all the energy that we store goes into the tummy, right?
Especially men, tendency to just store it
there. Is there a gauge on what is a good fat percentage that we should aim to strive for?
If you talk about just the waist, they talk about 90 cm. Men, if it's more than that, usually it's not so good.
Right.
The percentage depends on the individual. So of course, the lower the better. So that one is something that there are a lot of guidelines and all that which you can look at. Some say for men a bit lower than women can go 28%, men try to go below 15% and all that.
Yes.
But those are just a guideline. Although, that's the other thing that a lot of people, is weight the most important? Actually, the answer is no.
Then what is most important?
Actually, it's exercise. So it depends. Are you talking about what is important in terms of controlling weight?
Yes.
That is diet. Right, it will control. Diet alone will help you to reduce weight.
Yes.
It's the single most important factor, diet.
Okay.
Right? But in terms of health, it's actually not weight. It's actually exercise. Exercise is a bigger factor in terms of health.
Contributing to your health itself. Okay.
So if I am overweight, you are not overweight. Okay. But I exercise every day. I walk 1 hour.
Right.
Just walking 1 hour. And you don't.
Right.
I will outlive you.
So actually,
by population,
you can be overweight and you're healthier than somebody who's not overweight.
Yes. So if you're talking about health, then if I walk every day, just walking, and if I add in resistance exercise, even better.
Right.
But I'm going to be much healthier than someone who do not exercise, even though they're normal weight.
Right.
So they will have very little muscles. They will be just bone and fat and skin.
So it also means that people who are skinny, not necessarily healthy.
Not necessarily.
Oh, okay.
But they must exercise. They must walk. The easiest exercise is just to walk.
Yes.
That's a basic because you're using big muscle group.
Yes.
And that is also where you have some form of resistance or weight bearing. So weight bearing is good for the bone, but resistance is good for the muscles.
Right.
Yeah.
I think the government also has been encouraging us to do a lot of step challenge now. So.
Oh yeah, because it's so simple, right? Just walk, right? Then 1,000 steps.
Just walk 10,000 or even 6,000.
And they get paid,
They get paid.
It's a voucher.
Voucher.
They give you free counter, free watch, everything. Yeah. I think there are very few countries in the world that has that kind of initiative to make sure that the country people stay healthy. And it's not too bad. I must say that they're doing a good job. So considering the fact that we are a well-developed country with good amount of access money, people travel a lot and have access to good food, hawker center and all that, right? And obesity is talking about less than 15%.
Yeah.
It's increasing, but it's still less than 15%. And overweight, although it's 40%, these two figures, while of course higher than a developing country or a starving country, is actually quite good for a developed country. Wow. Of course, we still need to work on it.
Correct.
It's not perfect, but I think it's in the right direction.
I do think so also. So I do see quite a lot of people, even my parents,
walking
also.
And that is actually the most important. Yes. That will make them healthier than people who within the normal weight but do not exercise. So the government is very smart. Right. They actually know what is the single most important factor and what to work on.
Right.
Yeah.
In your opinion, is walking enough or do they have to do more things?
It's the most basic, and if you have no time to do anything else, that alone is good.
Right.
But if you can do more, like say resistance exercise, and that would be even better.
Right.
So, and resistance exercise is not difficult to do. For men, a lot of us have learned it during army time. Push-up, very simple, right? Squat.
Yes.
So these are very simple resistance exercise, or even resistant band.
Yeah.
Right. It's very easy. During the COVID time, we were all locked up, and I did quite a number of this video with Joan.
Yeah, Joan.
And Augustine.
Yes.
On Facebook, on Instagram.
Yes.
Just doing simple resistance exercise when we're stuck at home, because that is, we can't go anywhere. But with that, and simple exercise, we could actually stay healthy.
Right. Okay. When we talk about the factors that affect your weight itself, we talk about genetics. We talk about diet and exercise itself.
Right.
In terms of weightage, what is the contributing factors that is most?
80% is diet.
80%
diet. If you talk about weight alone,
then
diet is the single most important factor. So just diet. No matter how you exercise, I think unless you are one of those like Olympian, right, that train 8 hours a day, the amount of exercise you do will never be enough to burn off the calories that you can consume.
Right. And I think when we talk about diet, right, last time when I was growing up, our parents always say every day must eat 3 meals. Breakfast, lunch, dinner to be healthy. But I do realize that after I start eating 3 meals a day, nowadays, I gain a lot of weight. So is it necessary for us to eat 3 meals now?
I think it can be individual, depend on your level of activities. Yep. If you are relatively active, like say, someone who exercise a lot, athletes, then they need, because otherwise they are going to lose excessive weights. In fact, my youngest brother is a personal trainer. He eats 5 times a day and he still will not gain weight.
Wow.
The reason is that he exercises. He has a very low percentage of fat with a high percentage of muscles. Right. Not the bulky type, very lean frame. But because of the muscles that he has, the high metabolic rate that he has to eat 5 times a day in order to maintain his muscle mass.
Oh, okay.
Feeling which he will lose muscles. And a lot of athletes are the same.
Right.
So I don't think it's a number. It is what you eat.
Right.
And what is your basal metabolic rate. And you and I, we're sitting, we don't really walk a lot. We don't exercise a lot. And hence, you will notice that for that kind of lifestyle, the amount of food you consume can be lesser. As often as to how often do you need to eat. 3 times a day is not a problem. It's how much total calorie you consume.
Right.
Because if you tend to eat 3 times a day and you eat, the total calorie is more than what you can burn, the excess calorie will definitely build up.
Right.
And for some people say, oh, intermittent fasting, right? That is the other question that I know you're going to ask, right?
Keto.
Yeah, keto and all that.
Yeah.
These are just terminology.
Yes.
And I suppose to give people a easy target. Okay, I do this, I do that. Easy to follow. But at the end of the day, it's actually very simple. Total calorie and the type of calories that you are getting your nutrients from. Total calories depend on your body size, your muscle mass, and that which then give you your basal metabolic rate. And there are a lot of apps. In Singapore, the government has one. They can help you calculate your total calories. You just key in your weight and all that. They give you a rough one. And based on that, then you calculate the total calorie that you
require per day.
Yeah. Again, the apps, actually you can just take a photo and just put in, they can tell you how much calorie you are eating. So that is quite a simple way. So as long as your total calorie do not exceed your basic requirement, you are unlikely to gain weight. The problem is that a lot of our diet, the calorie is quite high. Mee siam.
Correct.
all
the carb-savvy food.
Or like chicken rice. Or even a lot of people do not realize dim sum. Super high calorie.
Wow.
So, or cookies look like very small. But because it's high calorie diet, you do not feel full with eating all these little snacks.
I don't stop at one.
Who stop at one cookie?
Once you open a can of Pringles, you eat the whole can.
Yeah, correct. And so because of that, and they get absorbed very rapidly, because they are processed carbohydrate. They are like simple sugar. Glycemic index is actually very high. You get absorbed. The sugar level goes up very rapidly. And if you do not use it, you get converted and stored as fat, because our body is very good at conserving energy. And the sugar level will drop rapidly. And you start feeling hungry again. And then you will eat again. And that is the reason why we gain a lot of weight if we take a lot of processed that are high in the glycemic index.
So in a way, when you talk about processed food, when it comes to if you want to lose weight, that's one of the ultimate killer in this case.
You'll find it very difficult, right? If you eat a lot of potato chips and all that, you will never lose weight. So actually, if you eat natural food in a way before, like for example, fruits are also high in sugar. But because it is not processed, it has a lot of fiber. And fibers help to slow down the absorption of sugar. So you sort of flatten the curve. The glycemic index drop. And when it's absorbed slowly, your body has a chance to use it, and you avoid the spike of your sugar level and your blood sugar level, and it doesn't crash. And so you don't get the hunger spang. And that's important. And you find that, if I take more fiber, and I take things that are lower in glycemic, and you get absorbed slowly. Firstly, I can use it. I don't gain weight, and I avoid the hunger spike, so I don't feel like I need to eat again in a short time. After 1-2 hours, I feel very hungry. So that is a good way to control your diet.
So when we talk about eating food, and if you are really going for diet, maybe we go for options that are pure unprocessed.
In a way,
better.
More fiber like vegetables and all that. So that feel your society, and you do not feel hungry rapidly. Because it's important. I mean, when there is this concept of go on diet, you should forget about this term. Don't use the term I'm going on a diet. That's very bad. Don't think of that. You should think of what is a normal healthy diet. This is my normal diet. So you focus on what you should be eating. So if you focus on this is the correct healthy diet, and once in a while I can have a bit of like unhealthy food just for celebration, or something that I like char kway teow and all that, once in a while, and you know clearly that this is an unhealthy diet, right? That way you will focus on what is normal, what is healthy, and not, I'm going on a diet. You're not. You say, I'm going back to a normal diet. Right? This is normal. This is what I want. This is what I should be eating. That is unhealthy. Then it's easier. You say, I'm going on a diet. Then mentally you already set yourself to fail.
Very tired.
You're very tired. You set yourself up for failure. So it will never work, because this, I'm going on a diet again.
That's
it's
another
such
way
a
to
chore,
reframe
right? Reframe.
Correct.
You have to reframe it.
That's a very powerful reframing also. What about when we talk about 0-calorie drink? Does it affect
zero
sugar drinks?
That is controversial, but certainly, let's say if I have to buy a drinks, I take a drink that's low in calories. That is certainly better than one that is high in calories. That's why nowadays the food is labeled A, B, C, D,
Yes.
right? It's definitely better because if you talk about diet, talk about weight control, right? You talk about weight control by avoiding those high sugar content. You will definitely slow down or reduce your weight gain.
Right.
And if you have that desire to have something sweet,
Yes.
then low calorie drinks is probably a better option.
Right.
As to in terms of health benefit and all that, of course there's no health benefit in all this processed, colored and all that as well. But given a choice, both are not healthy.
Yeah.
But you choose one that is less unhealthy than the other, right?
A lesser evil.
I would choose a fruit juice. I would choose water.
Yes.
Which I think definitely is better than even the so-called low calorie soft drinks.
Right.
Soft drink is obviously not healthy to start with.
Correct.
Definitely not healthy.
Every time when they say it's zero sugar, then I feel it's healthier.
But it doesn't stop you from craving for sugar.
Yes.
Right, because psychologically you still feel that, oh, I must have a sweet drink with my meal. Why is it that you must have a sweet drink? I suppose because genetically we crave for sweet stuff.
Yes.
But if you keep feeding it, then the desire to look for sweet drinks would stay.
Correct.
So it is better to reframe it and say that, no, for when I eat a meal, I will take a normal drink.
Right.
That is a normal drink of water. That is actually easier on the tummy anyway. Okay, maybe I'm getting older. I like warm water when I eat. So it makes the stomach feel better.
Warm and
yes. And cold drink is actually not so good. It actually affects your digestion to a certain extent because then the body has to try and warm it up, to reach a body. I will just try to bring everything back to the temperature. You would, but it burn a lot. You use up a lot of your energy, and it's not so good for the gut. So it's better to drink not hot water, but warm water.
That is same as your body temperature.
Yeah, similar. Yeah, so it doesn't take up so much effort to try and rebalance it.
Yeah, understand. And when we talk about food itself also, so for me personally, usually after a meal, I will crave for something sweet, like a dessert.
Or sweet ending.
Yes, for me, that's something very bad for me.
Genetic. I say that it's genetic. Our body will crave for it naturally.
Right. But how do we actually stop cravings? Is there a way to stop cravings?
Well, there's always way to do it, right? But whether it is do you find ways to reframe your mind, and that's why I say that if you eat, make sure you fulfill your calorie needs. Get rid of the hunger span, and also to make sure that you have enough food. You do not need to starve. If you calculate the total calories, say for example, if you take a balanced meal with sufficient vegetables and protein, beans, nuts, and some meat, whether fish, chicken, or even beef, and then you also eat some grains, right? You find that it actually is quite full. And to get the enough calorie, say an average of 2,000, actually take quite a bit of food. Actually, you'll be quite full.
2,000 is quite a lot.
Yeah, you realize that you let's say you do some exercise, and for a man, a young healthy man, you need 2,000 calories usually, and you find that actually you have to really starve yourself to finish the food. It's actually quite a lot.
Right.
And so by the time you have your food, you may not want to eat so much of those sweet things. And you say, oh yeah, I do like some sweet things. Sure. So you have things like fruits. You can your watermelon, your mango, your bananas. They're all very sweet.
Yes.
And they're all very healthy. And the glycemic index is actually not very high.
Right. Is there a way or a simple way for us to know whether our food is a healthy and balanced meal? Is there certain guidelines that?
Okay, so you some people talk about this amount. Yes. Actually, it's very difficult. So what I would suggest is that when you look for food, let's say you are going marketing. You walk into the supermarket. When you leave it, you should have rainbow diet, all the colors. So from the natural source, not 7 7 colors. So if you go through all the different colors for your natural food, you will have your usual green, you have your red, you have your brown. That means your nuts and all that, right? And then you will have some yellow and all that. That give you and even purples and all that. Why? Because the different color represent different macronutrients.
Right.
And you will want to make sure that all those are inside there. You will have your fruits and vegetables, you have your nuts, you have your protein, and then some grains. Some people say, oh, why do you want to eat grains or rice and all that? There's nothing wrong with eating rice. It's just a matter how much you eat.
Yeah.
You do need some energy, right?
One bowl or two bowl makes a lot of difference.
Half a bowl.
Yes.
Depending on your energy level. It's nothing wrong eating rice, by the way. Nothing wrong.
Yes.
Yeah. So it's just a amount you eat. And if you eat with vegetables and all that, the absorption is actually slow down.
Right.
Or you take the brown rice if you want. All these are actually, it's about balance.
Let's say if a patient comes to you today, they have a weight management issues. What are the available treatment options that you have in your clinic?
I think the first thing that we do, right, is always to make sure they don't have any underlying medical problem. And that is very important. There are various medical problems. For example, thyroid, hypothyroid. They would gain weight and it's very difficult because they are trying to work against hormones. It's impossible. Or they have metabolic syndrome. They have some other like PCOS and all that. So when they have all this medical or even Cushing and all that, then there's underlying issue, right? Then that has to be treated first. Without treating the underlying medical issue, everything else is not of benefits, nor will they work. Number one,
so
sort out, make sure.
For that, usually you ask them to go for a test?
We would firstly do a proper history taking. We will do medical examination. And when needed, choose the necessary blood tests to exclude or to confirm our suspicion. So that is a typical medical consultation.
Right.
To sort out, to make sure that these things are excluded. So let's say these are all excluded and we realize that, oh, it's actually an issue of diet. Then that is where it's important to work on the diet.
Okay.
One simple way is to do what we call food journal.
Yeah.
You just record everything that you eat for the day and then you group them together and to see if are you overeating.
Yeah.
I had one patient who said that, no, I eat very healthily. And then when we took every photos and the time, then we realized that that's because her husband always come back very late.
Oh, okay.
And she being a very good wife.
We'll wait for him.
Yes, because her husband loved it that she eat with him.
Right.
So she'll be eating very late at night. She is so fat.
Okay.
She is actually a client of my youngest brother, who is a personal trainer.
Yeah.
And my youngest brother couldn't figure out why was this particular patient gaining weight, struggling with it, but she's so fit. She could lift weight heavier than him.
Wow.
She could run a marathon faster than him. We say, but she keep gaining weight. It's like so fit and yet keep gaining weight because of diet. It's the time of the eating of the food is also important. Because after you eat and you go to sleep, you will store all your food, right? So she was gaining weight.
So is there a timing where we should stop eating before we sleep?
Preferably 4 hours before you go to sleep.
Okay.
Because you don't want whatever they eat late.
Right.
No way of burning it, right?
Right.
So I like the concept of eat like a king for breakfast.
Yes.
Right? And so that you have all the energy that you can burn in the day. And then you can take your lunch when you think that you need it. And the dinner should be the lightest of all. I know in our Asian culture, it's always the other way around.
Dinner is the heaviest.
Yeah. Breakfast can skip, never mind.
Yes.
Right? But dinner must be wow. And that's probably one of the reasons why a lot of us are overweight.
Right. Does it work if I eat at 12 and I sleep at 4?
Okay, so when we eat late at night,
yes,
what will happen then is that the stress hormone cortisol will actually spike. And you'll find that you get very hungry if you don't sleep by midnight. And we all experienced that when we were studying, right?
Yes.
Oh, exam time. And we find that we get very hungry and we tend to eat more, especially craving for potato chips.
1 a.m. chips, yeah.
I remember in NUS, we will always go to the prata shop. So we will do that because, but of course we're young, right? We will burn everything and all that. And time is short. So within that few years, so we don't gain as much weight as we think. But actually it's very healthy and you probably gain at least a few kilos during the exam period.
Right.
But we just don't realize it. So when you eat, it's actually important. And if you eat late at night, high cortisol level will actually increase the sugar level in your blood anyway. Yes. And that's not exactly healthy. Right. And that's why you tend to gain weight if you eat very late at night.
Okay, after we clear the medical history and the diet already, what other options do they have?
There are, of course, medication. It can be oral, it can be injectable. And this has been something that has been around for a long time.
Yep.
There are development, and many of these, well, we use it often as a last resort. They all have potential side effects or complication. The early one, a lot of them will feel palpitation, insomnia, and it does reduce appetite a lot, but it just creates a lot more other issues that they have to be concerned with.
Okay.
The newer one is I think some of them is like the semaglutide and all that. There's a few of that. The LPG1 is an inhibitor, which mimic the hormone that is secreted when we are full.
Okay.
This hormone is secreted from the stomach to tell the brain, okay, I'm full.
Right.
And so now if you create it synthetically, you could actually lower the threshold and the brain or the body start to feel full faster.
Right.
That seems to be the new wave of treatment.
So in a way, those medications actually help fool your brain into thinking that you're full, and then you don't eat as much.
Yeah, so you eat lesser.
Right.
It is probably a useful adjunct to the whole concept of helping you to switch to a healthy diet. And it should be just one of the two that you use. But you must first want to change your mindset. Reframe it and say, this is what I want to eat, and this is how I want to eat, and that's what I want. But I feel so hungry. I can't seem to get full with this amount. I know it's correct. So how do I go about doing it?
Yes.
Then that's where the medication would be useful. So whether it's you take it orally or you take it using injectables, that is then useful. But it should be used in order to help you regain, to get control back of how you want to have a healthy diet.
Right.
And not as a replacement. Because if I don't change my diet, no matter how good is the medication, the moment I stop the medication, I will go back into that cycle and I will gain more weight than before.
Right.
Yeah. This yo-yo diet concept is actually not a good idea. Yeah, it should be something that you can sustain for a long period of time and eventually be able to have a sustainable lifestyle and diet that can maintain your weight.
Correct.
That said, it's not easy.
Yes.
Because there are studies that shows that our body always will try to regain the weight. And if I have, let's say my BMI is 23, if I push my BMI to say 30, when I lose weight, my body will always try to and go back to BMI of 30. There's a tendency to do that. It's the way that the body has reset the cycle.
Yeah, I also experience it. It's a threshold, we call it. So, but after we break the threshold, you have a new threshold.
Yes, yes.
Right, but breaking the threshold is very difficult.
Very difficult.
It's very difficult. But if you break the upper limit of threshold, also losing that upper limit is also very difficult.
Very difficult. So there must be a period. But when you bring it down, you must be able to sustain it for a prolonged period.
Yes.
Change the lifestyle, let your stomach shrink back to size. And once you say, okay, this is what I eat normally, and one of the things that I try to get my patient to do is getting rid of all their snacks in the house.
Wow. Okay.
Throw them away. You cannot say I'll keep it and I will eat it slowly.
Right.
That's our work. You cannot buy. Because once you buy it, there's something there. Once you get bored, once you're stressed, you will grab it out. You'll reach out and you will take it. So you cannot have it, not at your home, not at home, not at your workplace.
Right.
You have to get rid of all these things. It should not be in sight.
Right. I think I should get rid of all my pantry stuff.
Oops. Sorry guys. Sorry.
Then I've been eating a lot of Maggi
mee. Maggi mee. Oh, very bad. Maggi mee is very processed carbo, very high calories, a lot of salts as well. But that's what we crave for, right? We crave for salt, we crave for sugar.
It's the most convenient thing out there also. It's
not only that, because we like it. And so, company will want to sell it because it's so easy to make money out of it.
Yes.
Healthy diet usually doesn't sell very well, and most of them would not survive very long.
Right.
Yeah.
I think when I was looking through your website and all, so there are like treatments for toning and also like treatments to fat freeze, this kind of thing. How does it work for everybody, or? Okay,
so when we talk about body contouring, right? They are useful, but they do not replace proper diet. So if they are overweight, BMI 30 and above, it's not going to help them.
Right.
The amount of improvement you can get from all these treatments is going to be minuscule compared to what they need to do, which is diet. So once they control the diet, then this thing to help control or try to contour getting rid of some very resistant bulk become effective. And they're very effective. In terms of muscle building, some of them, they have problem doing it because they could have surgery on the back. They have a knee problem like me, right? So we cannot, and we have problem trying to strengthen certain muscles.
Certain areas.
Yeah, certain area. Yeah. Together with physiotherapy, proper exercise, those machines can help you to kickstart, help you the last mile, to help you build that bit of muscles that you need in order to cross over to be more balanced and to be able to start exercising. It's actually quite oxymoron where you actually need to be fit, play sports.
Yes.
If you are not fit and you try and play sports with sport is good, you will get injured. You will actually get injured. Okay. You actually need to exercise, go for physio, go for a gym, get someone to train you. Together with sometimes we're using machine to enhance it, to strengthen it faster. Then you can play sport without getting injured.
Right.
Yeah. I had a knee issue because I realized that I do exercise, I do this and that, but it was pain. I went to see my friend Professor Ben Tan, who's a sport physician, and he said that my muscle is imbalanced.
Right.
My lateral muscles is stronger than my medial. Okay. The way that I play sports is strengthening the lateral, but not the medial quads. So I actually had to do exercise to try and strengthen my medial quads. But it was quite difficult. It's painful, right?
Yes.
So I played cheat. Use the electromagnetic stimulation and strengthen it. When I went back, the muscle strengthened. Actually grew back,
Wow, okay.
Yeah. So of course it still takes time. I still have to do the work. I still have to exercise. I have to do, but it just speed up the whole process.
And it's also more targeted.
It's very targeted.
Right? You can target different areas of your body or your pockets of fats also.
Correct.
Right. I do see also sometimes salons outside they actually start to have this kind of weight loss program, and they also include this kind of treatments. How safe are they in salon settings?
So I think firstly, when a salon just try to sell you a treatment without first excluding the underlying issue or putting you onto a proper diet, and that will have very little effect. Or if they just tell you to stop eating, which is what they do, they just cut down everything instead of helping you to change your dietary habit, then that is not much benefit. Secondly, it will be the machine they use, whether is it a good one or HSA approved, and that is important. And thirdly, sometimes even with the best intention, there's always some possible risk. Like if the machine contains radio frequency, it can still burn. In some cases, accident, like not the contact is not good, or they start to sweat, so heat will build up. When you use radio frequency, it can burn, and in those cases, you still need medical treatment to try and minimize the injury.
Right.
So things can happen. There's no perfect way. Cool sculpting, and there are a lot of cool sculpting machines.
Yes.
And some of them has higher incidence of burn. And that then need to be managed again.
Right.
So it is a matter of, but are they capable of managing complication? I always share with my students, which are doctors, right? That the difference between a mediocre and an expert is not in doing treatment. I can teach a monkey and a monkey can put the thing on you. The challenge to become an expert is when you are able to manage complication.
Right.
That is most important.
Problem solve when it happens.
Are you able to, when shit hit the fan, are you able to save the patient? And that's why certain treatment need to be done in hospital, like bariatric and all that, or putting a balloon in. We wouldn't do that because we need a setting in the hospital. We need a anesthetist around, and we need to be able to manage those complications. So certain things, even for we will not touch it. We will refer to someone who specializes in those areas in the correct institution.
Okay, that's very nice. Okay, if there's one thing you want the audience to remember today about diet and about weight loss, what would that be?
I think balanced diet is actually the key to a sustainable long-term control of your weight and for better health. And do not forget about exercise, just simple walking. So if all else fail, and I mean walking, right, it can be as old and you can, as long as you're still capable of walking, it's the easiest. And if you do it after dinner with a family, it's not only good for health, it's good for social, it's good for your mental health as well.
Right.
Yeah. So proper diet and just keep walking, moving.
Keep walking and moving.
Stay
active.
That's human structure.
Yes.
As a human, you need to keep moving.
Right.
Don't stop doing that. Don't ever stop moving.
Nice. I think that's all the time we have for today.
Sure.
And Ray, thank you for joining us for the show today.
You're most welcome.
Yeah. So if you all enjoy the show, please remember to subscribe to us. And also turn on the notification bell. And also please follow Dr. Elias Tam. It's a TikTok star on TikTok. Yeah. So if you do like this kind of episodes, we'll be doing more in the future. Okay. And we'll definitely invite Dr. Tam again. Please join us.
Yes, I will come back. Yeah. So it's really fun.
Thank you. And we will see you in the next episode.
See you.